Hi, welcome to my channel. I'm Erin Hart. I'm a registered nurse and a health coach, and I help people to achieve permanent, sustainable weight loss. I base my coaching off of the most current evidence-based information. No fads, no gimmicks, just whole, real food and habit change. So if you want to get off of the dieting roller coaster and find peace, freedom from food obsession, and permanent results, then that is what I want to help you to do. I'm really passionate about my work as a health coach. The most recent statistical data from the CDC on obesity and people who are overweight in the US was done in 2017 and 2018. It showed at that time, 4 years ago, that almost 74% of all adults in the US are obese or overweight. Those are the most recent statistics. And that was before COVID. So imagine what the statistics would show today. Those numbers are much higher now. My video today is titled, Can I Afford a Health Coach? We're going to discuss the cost of obesity and how you cannot afford not to have a health coach. Obesity is a disease that involves an excessive amount of body fat. Obesity isn't just a cosmetic concern. It's a medical problem that increases the risk of other diseases and health problems like diabetes, heart disease, stroke, and certain kinds of cancers. I was in that obese category, and at my highest weight at 306 pounds when I delivered my last baby, my weight settled out at 284. I was diagnosed with class 3 obesity, which is the highest class of obesity. Unfortunately, the likelihood for people like I was who are overweight or obese to lose all of their excess weight is abysmal, less than 1%. And of those people who do lose all of their excess weight, only a tiny fraction of that 1% actually are able to keep the weight off. But I'm standing before you today at a healthy weight to tell you that the only statistic that matters is your own. And you can change your health and your lifestyle like I did. You can have the same kind of transformation. It's possible. Obesity is a major problem in our society. It increases your likelihood of a myriad of diseases, including stroke, heart disease, diabetes, and even some forms of cancer. The cost of living with those diseases is extremely high financially. Not to mention the years that can be taken off of your life and the effect that it has on your quality of life. Let me tell you that it is expensive to be obese. The cost of a hospital stay or the cost of an ambulance ride is really high. Think of the cost of a hospital stay from a heart attack. It's typically more than $20,000. The average yearly cost of managing diabetes in the United States for an individual is around $10,000 per year. The risk of obesity is so high that some doctors recommend gastric bypass surgery or other abdominal surgeries where the patient's anatomy is permanently changed to help them to be able to lose weight. And it's that important to lose the weight. But unfortunately, many of those patients end up regaining the weight. The cost of a gastric bypass surgery is around $20,000 to $40,000. This is just the financial aspect, and it doesn't address the indirect costs from missing work, decreased productivity, inability to work due to disability and early death, and it doesn't address the pain and mental and emotional toll, or the decreased quality of life from living with diet-related diseases. I've worked in the hospital for a long time. Before my current job in the NICU, I worked with adults for 3 years on the surgical trauma unit at the regional medical center in my area. And I saw firsthand in my patients the devastating effects of living with chronic obesity. And yet still, I wasn't able to change my habits at that time. It wasn't until I learned about what was happening physiologically in my brain and how to establish habits to bypass willpower that I was able to overcome my food addiction and able to lose all of my excess weight. As a health coach, I don't diagnose or treat any diseases or illnesses. I instruct all of my clients that they need to work closely with their primary care doctor. What I do as a health coach is to provide you with guidance, tools, support, and accountability. I offer you hope. My methods are evidence-based and focused on eating a variety and abundance of whole, real, unprocessed food from every food group. I recommend that my clients buy and read books like Bright Line Eating and Atomic Habits, although I am not affiliated with them in any way. I share what I've learned from years of working in the hospital as a registered nurse and what I've learned from my own experience of losing 125 pounds by abstaining from sugar and flour and eating weighed meals without snacking in between. I help my clients to choose what will work best for their lifestyle. And we customize a plan specifically tailored for you, and we carry it out together. So if you're worried about the price of hiring a health coach to help you to reach your goals, I just want you to consider the price of not reaching your goals. Consider the long-term effects that obesity can have on your health and well-being. Not everyone needs a health coach to be successful, but if you aren't having success on your own, let me help you so that you can get off of the dieting roller coaster and go on living your life. You know, you were put on earth for a reason. You need to do that. Having a healthier body will help you to fulfill your life's purpose. And I really want to help you to achieve that. But no one can transform for you. You have to do the work. But having a health coach dramatically increases your likelihood of reaching your goals. A health coach isn't an authoritative figure. I offer side-by-side leadership, and I can teach you strategies that will help you to be successful, achieving permanent, sustainable weight loss and lifestyle change. I offer a unique perspective because I once was morbidly obese, and I faced many of the same challenges that you face. I have been in your shoes. I know how painful and difficult it is to be obese and how difficult it can be to change, but I did it. And you can too. I truly believe that you can't afford not to have a health coach these days. The cost of a health coach can prevent a lifetime of expenses, disability, and early death from the diet-related diseases that are plaguing our society today. So if you need that extra level of support, please send me a direct message and we can set up a free consultation. Also, be sure to follow me on Instagram, Facebook, and subscribe to my channel on YouTube. I post daily and I put out weekly videos to help you on your path to a healthier future. Thank you so much for watching today. Be well, and I will see you next time.